project is based on homelessness due to domestic violence, and it's by Lateef Bryan and Lana Cannon. Okay, let's get started, guys. For section 1, we'll be summarizing the needs of homelessness due to domestic violence. In order to summarize these needs, we'll be looking at the background about the condition, the population, the problem, and the arena. Beginning, we'll begin to discuss the analysis of the population, which addresses the problems and the need for intervention. We'll also be looking at the analysis of the problem, the analysis of the arena, and we'll be revisiting the working hypothesis. What this means is we'll be saying if the working hypothesis of the intervention needs adjustment or is it not. In order to discover this, we'll be looking at the factors and the results. The analysis of this population are women who are suffering from homelessness due to domestic violence. Domestic violence can include physical, emotional, psychological, as well as financial. What we'll be discussing and touching on mostly is the burdens that result from this type of trauma and the instability of homelessness caused on these women. Getting into the analysis of the problem. The problem that we're discussing here is intimate partner violence, which is domestic violence, and it resulting in homelessness. Like I said, this is particularly in relation to women, but it can happen to men or women. So this type of abuse usually entails emotional abuse, sexual abuse, financial harm, and physical abuse, which is one of the most common forms of abuse. Typically, this leads to homelessness because they are sabotaged by their abusers. A lot of the times we see this type of abuse in homes where the man is the typical breadwinner or he makes more money, and women tend to feel trapped. They feel like that is their only source of survival and that if they leave, they will be homeless. And in a lot of cases, that is true. With this being true and statistics being so high in this case, it leaves them vulnerable to further abuse and lack of care. Another problem with this is the lack of affordable housing. I also believe another problem is the lack of support, external support, such as support groups or housing for domestic violence. There's a big systematic barrier to employment and the cycle of abuse and homelessness, making it challenging for survivors to rebuild their lives upon leaving their abusers. Though I touched on this a bit before when discussing the analysis of the problem, the analysis of the arena is pretty much simple. This will encompass the social, the economic, and political factors that contribute to domestic violence and homelessness among women. In the society that we live in, the power dynamics and relationships are pretty steadfast in set. The man being the one bringing in the money, the provider, and the woman taking care of the home, raising the kids, etc., etc. With this being such a prevalent thing in our society, it typically leads to women not having the resources to leave when they're being abused or finding or feeling like they can find better. Bigger economic factors also play a role in the analysis of the arena. Poverty is so prevalent in this day and age, the lack of affordable housing and financial dependence. The systematic barriers also play a big role in the analysis of the arena, as social service systems aren't there for women. I mean, we see a lot of shelters that may keep you from 6 a.m. or till 6 a.m., things of that sort. We don't have a lot of funding for support services for this type of trauma care. It hinders survivors' ability to be able to have the access to the resources they would need to be able to adequately move on from their abusers and not worry about when they're going to get their next meal, or where they're going to lay their heads at that time. It is hard to escape your abuser when you have to worry about economic factors such as homelessness and poverty just because you want to escape. When discussing the working hypothesis, it's ideal to think that transitional housing alone may be enough to address this problem at hand. But sadly, in the world that we live in, it's no longer enough. Transitional housing is a temporary fix for a long-term problem that we see everywhere in America, everywhere around the world. A lot of the times we see these transitional housing being used for a temporary fix where they may supply you with maybe government assistance for the money that you need temporarily, but it's not enough to fully start a life without your abuser. Instead, I think a better approach to this complex problem would be on a macro level intervention. This macro level intervention would include, but is not limited to, policy reforms and increased funding for support systems. Some micro level interventions could include trauma-informed care, which we lack as a society, and advocacy. I think it's normal to believe that women are just complaining, or they'll be fine, or they can just leave. A lot of the times we hear the women, just leave them, it's okay, you have support, when they truly don't have the support nor the funding that is truly needed on a micro or macro level. These changes will be needed to effectively address the root of domestic violence and homelessness.
So in order to determine the effectiveness of this hypothesis, whether or not it will work or whether it needs to be revisited, we'll first need to look at some of the factors that are involved and some of the results. So I'm going to talk about some of the factors that are involved in this hypothesis. The first one is policy reform. And with policy reform, implementing policy changes to better support victims of domestic violence, such as increasing funding for support services, establishing housing assistance programs, and strengthening legal protections for survivors. Factor number 2 is economic stability, addressing economic factors that contribute to homelessness among survivors, including providing financial assistance, job training programs, and access to affordable housing options. The third factor is community support, enhancing community support networks for survivors of domestic violence, including shelters, counseling services, and advocacy organizations. The fourth factor is trauma-informed care, integrating trauma-informed approaches into support services to address the complex needs of survivors, including mental health support, substance abuse treatment, and holistic healing practices. And finally, education and prevention, increasing awareness and prevention efforts to combat intimate partner violence and promote healthy relationships, including school-based education programs, community outreach initiatives, and public awareness campaigns.
With these factors, due to the working hypothesis, also comes results. And some results from these factors, like I said, include but are not limited to improved access to housing. This means just increased availability of affordable housing options to the people that need it. Enhanced support services, organizations, counseling, assistance, whether it be legal or community assistance, and economic. Number 3 would be the empowerment of survivors. When people don't feel so shunned for the things that they have allowed happen to them, they are granted the grace and the empowerment to advocate for their rights, to access these resources and build self-sufficiency in order to reduce how vulnerable they feel in these situations. Number 4 would be the prevention of the future violence. With education and prevention, as well as the trauma-informed care, the reduction in these incidents of intimate partner violence through, as I stated before, education, prevention, and early intervention could break this cycle of abuse. And last but not least would be the systematic change. Positive shifts in societal attitudes would lead to greater accountability for the people doing so. This means increased support for the survivors, less guilt, and a better approach to address the problems.
I'll be presenting sections 2 and 3 of this presentation. Section 2, I will be proposing an intervention. So with that in mind, I will develop a working intervention hypothesis. I will talk about what interventions are implied by the working hypothesis. I will determine whether or not these interventions would potentially reduce or eliminate the problem, and I will expound on what results can be expected from these interventions. So for this slide, I'll be reading from left to right. If we can do the following, then we can expect the following results. Number 1, if we can increase and improve survivors' access to specialized counseling services, survivors will develop better coping strategies, regain self-confidence, and make informed decisions about their future. Number 2, if we can increase access to affordable and safe housing options, survivors are less likely to become homeless or return to abusive environments due to lack of housing alternatives. Number 3, if we grant extended stays in transitional housing programs, survivors will have more time to stabilize their lives, secure permanent housing, and establish financial independence, reducing the likelihood of returning to abusive situations. And finally, number 4, if we prioritize the safety and well-being of domestic violence survivors through policy reform, we will see improved coordination among social service agencies, law enforcement, and legal systems, leading to more comprehensive support for survivors and increased accountability for perpetrators. This hypothesis demonstrates how each intervention could potentially contribute to reducing homelessness resulting from intimate partner violence by addressing the problem at micro and macro levels, thus providing the necessary support for survivors. Now I'm going to talk about some of the proposed solutions to the problem. So, domestic violence, as complex as it is, requires a comprehensive and multi-level approach, a holistic approach with tailor-made solutions to meet the complex needs of this population. So at a micro level, I propose access to trauma-informed counseling services in shelters, which will allow survivors to receive the support they need to address the psychological and emotional effects of domestic abuse and homelessness. And the goal here is to help survivors work towards healing, to rebuild self-esteem and develop life management skills in order to live a healthier life. The second intervention I had in mind was increasing housing assistance to help survivors gain access to affordable, safe housing options. By expanding programs like rental subsidies and emergency shelter vouchers, survivors can secure immediate housing, reduce the risk of prolonged homelessness, and begin the process of rebuilding their lives. And this is more of a macro level intervention, which will probably require some funding through a government agency. Continuing with the proposed solutions, the third solution I have is related to extending the stays at transitional housing shelters. So as it stands, transitional housing stays average about 60 days, and it takes someone approximately 6 to 10 months to find sustainable, suitable housing. So with that in mind, connecting survivors to transitional housing with increased time will increase their ability to access, it will increase their ability and their time to access critical resources such as legal aid, financial assistance, food assistance, job training programs, while receiving the necessary ongoing support services, and while securing permanent housing and improving their chances for sustained success and safety. And finally, the last intervention I'm proposing is with policy reform. So policy reforms are a critical element of the solution. Policymakers can enhance support systems for survivors and improve their chances to receive justice by allocating resources towards victim services, shelters, counseling programs, and legal aid initiatives. In order for policymakers to better support their constituents, I feel they need to examine this issue of one, domestic violence and homelessness as a result of domestic violence as more of a societal issue and rather than a personal one. This brings me to section 3, which is our logic model. When I created the logic model, I thought of agency level solutions, and I picked 2 solutions specifically from my hypothesis to think about. So we're going to again move from left to right on the screen. The situation: homelessness due to intimate partner violence is a societal epidemic that requires a multi-layered response, including trauma-informed counseling and additional funding to increase the length of stays in transitional housing shelters. So the priorities that we're proposing are to improve the shelter support services to our homeless survivors of intimate partner violence by shifting our counseling approach towards a trauma-informed counseling approach. And second, to increase funding to help lengthen the average stays from what's the current average of 2 months to at least 4 months. So next, I'm going to talk about the inputs and outputs and the goals. So what are the inputs at this agency? We have our shelter staff, we have the director, we have the shelter manager, we have the social work supervisor, we have the social workers, and the case managers. In the funding and support arm of the shelter, we have our donors, we have our funding agencies, whether that be government or other benevolent charitable organizations. In addition to that, we have our support staff, which includes our volunteers and our interns. So that leads me to our outputs. What do we do and who do we reach? What we do is we support victims of homelessness due to intimate partner violence by providing shelter and counseling for the residents. Again, our second arm of the business is the fundraising arm. We seek additional funding through various funding sources and efforts, whether that be endowments from donors, grants from public agencies or charitable organizations, in order to address increasing the length of stays, and secondly, to address training employees on trauma-informed care if they are not trained on it. And who do we reach? For the sake of this project, we are reaching women and children who have been affected by homelessness due to intimate partner violence. So if you look at the bottom, I wanted to talk a little bit about some of the assumptions. A shelter resident should assume that they would receive immediate safety, access to support services, confidentiality, and the empowerment to make informed choices. The shelter should assume or recognize the need for trauma-informed care. They should understand the complexities of domestic violence and the need for a tailored approach to support the residents. Now I want to talk about the short-term goals, midterm, and long-term goals. On a short-term basis, trauma-informed counseling will help residents build trust, have their needs assessed, and provide immediate emotional support for residents. And longer transitional housing stays will ensure the safety of residents while helping them rebuild key components of their life. So this is the start of them putting their lives back together. Our midterm goal with trauma-informed counseling is to help survivors reduce trauma symptoms while increasing their coping skills in a supportive environment. And our long-term goals with trauma-informed counseling practices are to lead to better mental health outcomes and improve chances of successful reintegration into society. Increasing the length of transitional housing stays can lead to greater access to support services, higher success rates in transitioning survivors to permanent housing, thus fostering long-term self-sufficiency and reducing a major component of the homeless population. So some of the external factors that come into play with the outcomes side of things is the availability of funding sources. Of course, if we cannot fund it, we cannot do it. Community support, so having advocacy groups, shelters, other shelters involved in similar programs and counseling services. Collaboration with law enforcement and social services, the accessibility of affordable housing, and unfortunately, the stereotyping and stigmatizing of survivors of intimate partner violence and the homeless population as a whole by society, which just makes things infinitely more difficult on an emotional level. These are our references for this project. On behalf of Alana and myself, thank you for listening. I hope you found this presentation informative and entertaining. Have a good day.